So, Dr. Thompson, can
Hi, Bailey.
you help us just see behind the scenes of what actually happens in an integration session and what makes it different from just your standard therapy?
So it's similar in that we're using the same tools. We're therapists. I'm a trained psychologist. That's my tool bag. I'm working to apply these skills specifically in the context of a psychedelic or a pseudo hallucinogenic client experience. So in that way, it's different than in terms of how what we may be doing in traditional psychotherapy, where that's not part of the content that may come up. And so for some people that may sound scary. And if you haven't had a lot of experience yourself or with working with others with maybe bizarre or unusual or psychotic thought content, that just can feel scary. To me, this doesn't feel scary at all. I'm actually excited in that I know it's being stimulated in part by a variety of things, but at least in part by two things. One, their motivation, and two, from a drug that's been safely administered to them, and that they're likely having some degree of a positive experience alongside it. It doesn't mean that their experience is always beautiful and pleasant, but some aspect of the ketamine infusion, for all the folks that I talk to, generally find some element of it fascinating, enjoyable, and calming. Because these are a great foundation to build on in therapy. So I know that the ketamine, if it's doing its job, is helping this person's mind, their body, getting into a place where they're going to be able to start moving more flexibly and from a less guarded like posture. And so, you know, I guess when we're conceptualizing the work of the therapy, what's really happening is we're working to maximize growth during this critical period, like we would think of developmentally, critical periods for language or whatnot, or really think of this infusion time as a critical period for this person, for their brain to open to new possibilities and be willing to explore them. So that's the way I think in which it's highly different from potential other like traditional techniques or tools and to what we're applying it into. In my opinion, in its purest sort of form, and now this is where you're gonna really kind of start to experience how I conceptualize it and the other modalities I use. You're gonna start to hear that being infused within. Nevertheless, so in its pure form, I conceptualize ketamine assisted psychotherapy as being client-centered. It's mainly non-directive and it's highly experiential. The main goal really being to enter that space with them and matching and collaborating in that exploration in support of that exploration. I'm not an all-knowing person. I don't think that's a good way to enter the space really with any client, definitely not in this scenario. So really moving into that space so it can become emotional, spiritual, creative, a depth of historical content of their experience that can be engendered really rapidly. And they may be in a space to share it, which is the beauty of this process. You experience an increased social connection and willingness. At least that's my observation. I frequently observe that in folks who are going through the infusion process. When they come in, there is an increased willingness, openness, a little less skepticism than perhaps prior to the infusion. All the sessions aren't necessarily just integrated about integrating the experience during the infusion. For some people, that may be the bulk. But for all of them, at some point, you're likely moving more increasingly into the present and increasingly into like a change orientation or acceptance orientation, whatever that might be for their life and how they're going to move forward from this. You know, the ketamine infusion itself is generally about 6 sessions. And so the integration part is very short-term and time limited. Now, therapy can extend beyond that, and it often does. At that point, it's no longer ketamine assisted, and it's probably going to start to move more into traditional psychotherapy modalities and really working to continue to build upon that progress that was initially made, and then anchoring it more and more into the present moment, into their recovery. Oh, this is where I really want to mention this. So like just wanting to highlight that like what I see as the priorities for us is to explore that psychedelic memory that they just had to the extent that they are able to really try to help our clients experience and deepen into the antidepressant impact from said ketamine and attempting to understand and empower that within themselves in their current view of self.